Good morning, everyone. My name is Elizabeth Apia, and I did an article review on health behavior predictors of medication adherence among low health literacy people living with HIV and AIDS. So the introduction of this study. This aims to ascertain the relationship between medication adherence and other common health behaviors among people with low health literacy skills living with HIV. Health literacy is known for providing access to health-related information in order to inform and improve health decision-making, behaviors, as well as the outcomes. So as we've learned in class, it's important for health professionals to speak in a way that an audience understands, and the professional should take health literacy into consideration when talking to their patients so that mistakes of missing doses of medications or overdosing on medications can be prevented. In 2005, AIDS-related deaths have decreased from 2.3 million to 1.6 million as reported in 2012. The research problem. Studies have shown that a robust relationship between poor ARV adherence and lower reading ability as well as numeral literacy. Positive relationships among distinct health behaviors would suggest an integrative approach to healthcare messages and unifying medication adherence with related health behaviors to prompt coaction. The research objective. It's essential for healthcare professionals, again, to make sure that when they're creating a list of dosages that people are supposed to take when it comes to medication, that patients are able to understand it, that the audience is able to understand it. So in this case, your audience will be your patients. And if you're going to write a specific prescription for them or instructions for them, medical terminology is not something that's going to be advised to be used in this case because some people have poor health literacy skills. So it's not going to be beneficial to them, and they might unfortunately miss a dose of their medication because they don't understand what the health professional is saying, or they might actually overdose on it. So we want to make sure that we're talking in a language that everyone will understand, not pretty much using medical terminology to confuse the audience. Methodology. A 3-month baseline period of randomized individuals had conducted a study on targeting medication adherence for individuals who had limited health literacy. This study was conducted in Atlanta, Georgia, where there was an endemic outbreak. Low literacy as determined by scoring below 90% correct on the functional health literacy test. So there's a functional health literacy test, and individuals were considered having poor health literacy skills when they scored below 90% on the exam. So some of the participants were categorized based off of their gender, their race and ethnicity, their age, their income, employment status, as well as education. Participants had to be at least 18 years or older. They had to have tested positive for HIV. And when they were asked about their feelings about the study, it was pretty much on a 0 to 3 scale, where 0 was not at all, 1 was a little, 2 was quite a bit, and 3 was very much. For the statistical analysis, linear regressions were used in this study, and participants were asked to complete at least one medication adherence pill count for over a 3-month period, and then after that, a 3-month follow-up was also conducted to see how the study went after. Demographic variables were also set as predictors of adherence to see which characteristics were predicted at the point of adherence. Results. So at least 437 participants were in the baseline of one medication adherence pill count. 37 participants did not complete any pill counts, and these were participants that were compared to individuals that had at least one pill count. The results has showed participants were not significantly different based off of demographics or psychosocial measures. Participants who did not complete any unannounced pill counts had significantly lower scores, and the results of this were T was equal to negative 2.73, while the p-value was set at 0.01. Discussion and conclusions. Individuals being more cautious with their health can lead to an overall healthy diet, and individuals being more concerned, they'll be concerned about their health overall. So, for instance, if someone knows how severe HIV is, some people that go to the doctors will be diagnosed with HIV, but probably won't know what HIV is. So once the healthcare professional is able to explain to the patient what the disease is, on top of how to treat the disease, not really cure it, but to treat it and to kind of control it, they will be able to be more concerned with their health in general. So they're going to know that they have to take these necessary precautions, or they have to take these necessary steps in order to make sure that they're living a healthier lifestyle. So also going back to the whole dosage of the medication, if the doctor is telling the patient, you have to take this amount at this certain time, they're going to understand, and they're going to know that, oh, because I want to be healthy, or because I want to at least stay strong in this particular area of my life, I need to make sure that I am on top of my game when it comes to my health care. Limitations and future research is based on daily processes and can utilize daily diaries to provide further detail on these relationships. So the future research would basically have to focus on a more detailed set of behaviors, and individuals, in order to keep track of their health care, could also use like notebooks and diaries and just anything that they're able to use to write down, to remember how much they're supposed to take, at what time they're supposed to take it. They can kind of take notes of what the health professional is telling them, so that they'll be able to take control of their health care, take control of the disease that they pretty much have. So in this case, HIV/AIDS. So when the medication is given to them, they'll be able to write it down in a way that they understand it in a notebook. And future research to kind of just touch light on maybe individuals doing that first after they possibly complete a survey, and then they know that from here on out, like, this is how I'm supposed to live my life. This is how I'm supposed to take medications in order for me to stay strong, stay healthy, and so on and so forth. Limitations did not rule out a third unknown variable, which could drive both adherence behaviors and diet behaviors. So one suggestion for achieving this goal would be to integrate medication adherence to the everyday health routines of the individual. So again, if the person is to wake up at 8 o'clock in the morning and they know that they have to take a certain dosage, they're taking that at 8 o'clock in the morning. Whether they have to set an alarm to do it, whether it's in a notebook, it's just making sure that we as health professionals are catering to those with poor health literacy skills. And a disease like HIV or AIDS, having that, they're not missing essential information that they will need in order to stay alive and live their lives on the daily. So it's supposed to be more of a habitual thing. Or if it's maybe an individual that has HIV or AIDS is at work at 12 o'clock and they're supposed to take such medication, because it's something that's a habit to them, they'll be able to get up and they'll be able to understand and remember that, oh, okay, I have to take my medicine at this time. So whether they're going to go to the bathroom, they're going to go to the next room, next door, whatever they have to do, they're going to know and they're going to remember that, okay, at this point in time, I need to take this medication. Or before they're going to bed, they need to know, okay, it's 9 o'clock p.m. at night. I'm supposed to take 2 doses today, whether it's written in their diary as discussed before or placed in their memory because they pretty much made it a habitual thing. That was the point of this study, to do a 3-month trial with individuals who had HIV to kind of test and see if, okay, if we make this more of a health behavior, a healthier lifestyle for them are they going to be able to remember and understand that, okay, this is how I'm supposed to take my medication at what time, and so on and so forth. So factors such as coping skills and or personality traits could also be a factor when conducting a future research. So this is my reference, and that's all I have for today. So thank you.